Hi everyone, welcome to the Prologue to Wellness podcast. I'm your host Cheryl, and today I'm very excited because we're talking about a topic that's very close to my heart. It's something that a lot of women talk about, but they don't actually really want to talk about it. It's the menopausal brain fog. What is it exactly? And if you felt that you've walked into a room and suddenly forgotten why, maybe you've forgotten your friend's name, maybe you're not alone. We're going to talk about brain fog today with Dr. Odelia. Dr. Odelia is our medical director and a lifestyle medicine enthusiast at Prologue. We're going to be talking about menopausal brain fog, Dr. Odelia. What is it exactly?
So I think the term itself speaks for itself. So brain fog is a term that generally describes a few symptoms. It can be, for example, you find that your memory is not as sharp as before. You are taking a longer time to retrieve certain memories. You feel that your focus is not really there. Basically, you feel a bit different from how you're functioning before that. And for many ladies, it does happen around the perimenopausal or menopausal area. And then most of the time, people don't really talk about it. Because as ladies, I think we're very used to multitasking, thinking about many things at the same time. And so this is something that we tend to put aside because it doesn't seem like something that's very significant. However, it does affect ladies, and it's important to talk about it because there are various ways that we can help and also make sure we're not missing other things that could be contributing to these symptoms.
Okay, but how is brain fog perhaps different from, say, just general forgetfulness?
Okay. So brain fog, for example, you're looking at something that in terms of your memory, you may feel that I feel that I am forgetting more than usual, or I'm taking a bit longer. For example, if you walk to a kitchen to get something, usually you're able to remember what you want to get. But then when you're in brain fog, you find that this is a bit different from how you were previously. But whether it's dementia or not, so that is a different topic altogether.
Okay.
So brain fog is more of a general term. It's not a medical diagnosis per se. This falls under the whole category of cognitive issues.
Okay.
So cognitive issues has a spectrum. So dementia is a later stage. That's when your function is affected. There is a decline in your previous level of functioning. Before that, there can be mild cognitive impairment, and even before that is subjective cognitive impairment.
Okay.
And for most ladies, it falls under still the normal range. But whether you know it's significant or not, or abnormal or not, you may not really fully understand. So it's always very important to speak to your healthcare provider or doctor to find out more. There are more questions that they can ask. There are certain tests that they can administer. And also, more importantly, they can also look for reversible causes. So through a health screening, you can look for thyroid issues, you can look for vitamins, for example, vitamin B12 deficiency, which all can contribute towards your brain health. And then finally, it also helps you to screen what's your cardiovascular risk, for example, your high blood, your any diabetes or cholesterol, because all these are very significant risk factors in terms of intervening to prevent true vascular dementia later on.
Okay. You mentioned about the spectrum earlier, and brain fog does not fall within the spectrum, basically.
Yes.
So if it's not medical, is it real? Because there is also a term that many women have faced before, which is the mum brain, and the mum brain also kind of like presents like forgetfulness and things like that. Is that the same thing, or is it totally different?
So I will look at the description of brain fog as a description of the symptom.
Okay.
But whether it's truly significant or the severity, it can still fall under the spectrum of a normal or abnormal state all the way to dementia. So for example, if you have a cough, you go see a doctor. There are many reasons for a cough. It could just be a common cold, or it could be something that's a bit more serious, like a lung infection, or in very rare cases, even cancers. So when you talk about brain fog, it's more of a symptom.
Okay.
For which you go to find out more information about the severity and the underlying cause of it. Mum brain is something that's very common. That I think for anyone with young children, when you're sleep deprived, when you're trying to juggle work, family, you tend to be forgetful too. And so the factors for these two issues are quite similar. Hormones play a huge role.
Okay.
With regards to brain fog. So during like the peri or menopausal period, so there are a lot of hormonal fluctuations, and estrogen is one thing that we are looking at. I think there's a lot of evidence that estrogen does affect your brain health. But how much it really affects and how it really impacts it in the long term, there's still a lot of research that can be done. I think the main postulations would be for estrogen, it helps with your blood flow to your brain.
Okay.
It helps your body, or your brain in particular, process its energy source like glucose. And it helps in the regulation of neurotransmitters, for example, like dopamine and serotonin, which helps in terms of your memory as well as your mood. That being said, right, during the perimenopausal or postmenopausal area, there are a lot of additional things going on. For example, other symptoms like night sweats, hot flushes can affect your sleep quality.
That's true.
And when your sleep quality is affected, your memory is affected the next day. You feel you're not as sharp as before. And also stresses. There are many, many hats that women wear. And when we are faced with different stresses, different responsibilities, your mind is always on a certain task. In fact, it's running between certain tasks. So it's always preoccupied with a certain worry or different thoughts. And when you're distracted, you may find that your memory is not as sharp as before.
All of that actually plays a huge part as well. It's really looking at everything.
Yep.
So if, let's say, someone is perimenopausal and maybe experiencing some brain fog, is there anything that they can do to like exercise the brain, make it clearer, things like that?
So there's a lot of things that you can do, and it not just helps your brain health, but also helps your overall health and also your mood as well. So for example, our brain always likes novelty, it likes new things. So you can look to picking up a new skill, trying a new sport, trying a new exercise. That will also help your cardiovascular health and your overall health as well. You can try like new recipes and different things. So when you do different things, also that's a way to relieve stress as well. So all these have multiple effects on your well-being as well as your mental health. You can look at doing things like puzzles. Actually for the older individuals, they may even look at things like mahjong or different kinds of, a lot of different kinds of ways that you can stimulate your brain. And very simply, you can also just make good social connections. When you go out, you talk to friends, you engage in a community, you are part of an activity, your brain gets stimulated as well. And that also helps your mood.
Which is why mahjong is actually great.
Yes.
It stimulates your brain and it actually gives you a social connection at the
absolutely.
same time. Okay, so really tricking, actually novelty is a beautiful thing, but what happens when you're old is you often you refuse to try new things. And the challenge is perhaps to try new things as you get older and to actually just make sure you exercise the brain. Okay. And let's talk about maybe a little bit about the spectrum, because if you have like maybe a little bit of brain fog, when is it going to be something that is really like a health concern?
So when you find that it's affecting your daily function, so that's one indicator that you should seek medical attention. And the other way is when simple interventions, right, do not help to correct it. So for example, you may be slower in retrieving certain information, but if you give yourself a little bit time, right, you are still able to get that memory back. For example, if you find that one way is to see whether you can slow down first, take a step back, refocus on your task at hand. And if that is okay, you go back to doing your daily chores or your daily activity as per normal, right? Then that's not so much of an issue. But for example, if you do realize that after waiting for like 5-10 minutes, you really still cannot remember, right? Then that's an indication that you should seek medical attention. Another thing is to ask your family members and those around you, because they see you on a daily basis, and they are able to tell you whether what you're doing is normal or you feel that it's a bit more something of a concern that you need to seek medical attention for.
Okay. And I guess if any of you have friends around, you would probably also notice if she's kind of acting a little bit differently. She doesn't remember things like before. She's forgetting my name and stuff like that. That's what you can look out for.
Yes.
Dr. Odelia, maybe from a lifestyle medicine perspective, is there anything that we can do to kind of help with managing brain fog or maybe preventing it?
There are actually many things that we can do. So if we look back to the 6 pillars of lifestyle medicine, so first one is for whole foods and good nutrition. So you can eat foods that are healthy for our brain. For example, a lot of foods that are high in omega-3s. For example, like your good fatty fishes, walnuts, dark green leafy vegetables, or antioxidants like your berries, all are very helpful to your brain health. Also eating a balanced diet, choosing less processed food, more whole foods, that will also help towards you feeling better and have a clearer mind. Physical activity, exercise is important. Just going out for a walk, getting some sunshine actually helps your body feel much better and also clears your mind. The other thing that we're looking at is to make sure that you have good sleep and also good stress management. Slow down, make sure that you are focused on your task, and also guard your sleep time to make sure that you have a good 7 to 9 hours of sleep and you feel well rested the next day. Because all these poor sleep stresses can also affect how you focus and how you concentrate the next day. Then also equally important, you want to reduce any cardiovascular risk factors. So other than going for a health screening, reduce, for example, tobacco as well as alcohol. All these will help reduce your cardiovascular risk. And finally, very, very important is making good social connection. When you even talking to your friends, finding out that they're all going through the same thing is very helpful and also reassuring. Then you know that you're not alone in it. it, you can also get tips from your friends, from their different experiences that they go through, and you can go through this journey together. And it's really, really important, helpful, and even beneficial for you in terms of feeling good as well as your friend in going through this journey together.
I think that's really important, because a lot of times you feel like you're losing your mind, but when you have friends around you that are going through the same thing, it doesn't feel the same. So last question, Dr. Odelia. Are you really losing your mind with brain fog?
So you are not losing your mind. You are going through a season in life.
Okay.
It's important to see where you are. Make sure you're not missing like the true causes of like dementia or correctable causes. But once that is excluded, right, it's a good time for you to maybe take a step back, focus on your life, what's ahead of you, and also focus at what you have in the present. So live in the present moment, enjoy your blessings and the various things that you have around. Slow down and see whether that helps you to understand yourself as well as your memory and the different factors of your lives better.
Thank you, Dr. Odelia, for sharing all your insights with us. And I really feel a lot calmer actually talking to you, and I've cleared my mind. If you have any questions, feel free to reach out to us at Prologue. Or if you're looking for social connections or a community to be part of, feel free to reach out to our friendly consultants or our health professionals as well. That's all we have for you today at the Prologue to Wellness podcast. We hope you enjoyed this episode. Don't forget to follow us on Instagram at Prologue to Wellness and Prologue Clinic. Till then, take care and be well.